My name's Dr. Manrina Rhode and I'm the Aesthetic Dentistry Expert for dentistry.co.uk. And today I'm going to talk to you about black triangles. So first of all, do you know what a black triangle is? It sounds a bit like a black hole. They are little black areas that you get interproximally between teeth, quite close to the gum margin. And they could be there for many different reasons. They're usually there due to loss of papillae in the area, so a blunted papillae, and the papillae could be blunted because of gum disease, you've had recession, periodontal disease. It could be blunted post-orthodontic treatment, so where teeth were potentially crowded before, and then you've straightened them up, and the gingiva's not used to filling in that gap. You can tell after treatment if that papillae will fill in by measuring by bone sounding. So if the contact point, the highest point of your contact point between two teeth is 5 millimeters from the crest of bone, then more than likely that papillae will fill in and that black triangle will disappear. So it's worth sort of popping some numbing gel on the gum, taking a probe and popping it up until you hit bone, and having a little feel so you can feel a little more reassured. It's also something that I always make a note of at my new patient exams before starting any treatment plans or treatments, because in the case of a smile makeover, the black triangle is the last of a patient's concerns. And then you spend time doing some ortho, straightening teeth, whitening, veneers, bonding, whatever it is that you're doing, and they end up with this perfect smile, and then their one concern in life will be that small black triangle that they've got there. So you really want to make a note and let them know, look, that black triangle was there before we started, and so it's still there now, but look how amazing everything else is. Sometimes by trying to close the black triangle with the cosmetic work that you're doing, you end up with a worse result than you would end up with leaving it. So firstly, black triangles can't be closed restoratively with bonding or with veneers with a ledge. You don't want to leave a plaque trap so the patient can't clean. So your restorations always need to meet in a really comfortable way, but sometimes by elongating that contact point so that you're squeezing the papillae in, or you've got tooth there to close the black triangle, it can make the tooth look quite bulky, and so there's some aesthetic benefit to leaving a black triangle there. The other thing to consider when you're doing restorative work is sometimes there is no black triangle and you place temporaries where the teeth are stuck together while they're in a temporary phase. So in porcelain veneers, if you're doing 10 teeth, you've got 10 teeth stuck together in plastic while they go through their temporaries. And sometimes the plastic from the temporaries can temporarily blunt the papillae. So when you come to fit your porcelain, initially there's a black triangle, but you need to feel reassured it wasn't there before, and the gum will slowly just fill back into that space. What about black triangles that are caused by a gingivitis or a periodontal disease that cause recession, and you get quite an advanced black triangle, particularly around lower incisors? A treatment that I'm known well for are gum fillers. I brought the treatment to the UK from the States. I was over there learning and heard about the treatment, and I believe I was the first practitioner to bring it over. And what that is taking filler that you use in the face and placing that into the papillae of the gum to fill out that black triangle. Now, it only works, it will only give you a very small amount of filling. It's not like a lip where you can really get a good amount of 1 ml of filler in and expand them out and pop a mil in, once a month and expand to these ridiculous sizes that some people go to. The papillae is quite tight, so you're limited in the improvement you can get with gum filler, but it's lovely for those really tiny black triangles. You get a little bit of expansion of gum, and that looks great. Say gum filler wasn't enough and you needed to restore the black triangle with bonding. If you were going to restore it, then bonding always needs to be placed on two teeth. It seems obvious, but just in case it wasn't, on the mesial of one tooth and on the distal of the other, so the patient can still floss, mimicking natural tooth margins, so that the patient's able to floss and clean, and you're not creating extra problems by doing that. And then, of course, if you're going to orthodontically move the teeth and there's going to be some IPR involved, some stripping involved, then if there's a black triangle, you may want to position your IPR in areas where the triangle is so you can bring the teeth closer together and minimize that black triangle. So I hope that helped. I hope that was an interesting discussion or synopsis on treatment of black triangles. Have a good day.